So to release the quadratus lumborum muscle deep in the low back on the floor, I'm going to start with my softer ball. And I'm going to lift up my pelvis off the floor and bring the ball just to the side of the spine. Then I'm going to shift my hips, rocking a little side to side. And then I start to drop my knees off to the left. And as I do that, I just kind of feel that I go off into that space between my pelvis and my ribs and pushing against the sides of the spine. And that's where I can really get into the quadratus lumborum. And if I need some more, I want to find all that way from the pelvis up to the lowest rib. And if I feel like I need some more pressure, I can just start to lift my knee up off the floor, my foot up off the floor, my knee up toward the sky or knee toward the chest. And then I can shift my pelvis from side to side, and that's going to kind of bring the ball into that QL area. Ooh, and that's a tender spot. One of the main trigger points in this muscle lives right at the intersection of the spine and the lowest rib on the inside. So you want to make sure you get high up by those lower ribs. Drop the knees to get in. You really need to be at about a 45-degree angle or so to push into the sides of the spine to get quadratus lumborum. I take a breath and sink. And I feel that as I sink, and as I soften and relax, the ball actually goes a little deeper. Then I just move along. I'm going to walk myself up to move the ball down right in the middle section, right there between the lowest rib and the pelvis. It's often another spot. So I'm going to drop my knees, sink my pelvis down. And you can play with tilting and tucking the pelvis and see what that does. The tuck will drive a little more pressure into the balls. So you might drop your pelvis down like a tilt, tuck the pelvis under, and kind of wiggle side to side. So you just kind of play with that tilting and tucking, massaging quadratus lumborum. So again, this muscle can cause aching deep in the buttock, problems at the sacroiliac joint, SI joint dysfunction. Can cause aching over the top of the pelvis, even to the front of the body. And also low back pain. So I'm going to sink one more time. I found one more little spot. I'm going to sink and breathe. And then I rock around, and then I'm done with that side. I'm gonna lift off. And I always like to take a little break in between sides. Maybe do some windshield wipers, dropping the knees side to side. Kind of stretch that area. And then any kind of side bending is a nice way to stretch out QL. So I'm going to keep my knees and my feet where they are, and I might just kind of inch my body over toward the other side. And open up that side and push my hip down a little. But you could side bend standing or sitting in a chair, whatever way feels good. And then you're going to do the other side, same thing. Getting the ball in that space between the pelvis and the lowest rib, and working away, dropping the knees and clearing the other side.